Okay, thank you so much. Good morning, colleagues. Every year for 9 years running, we have taken time in these chambers to pause and recognize Ovarian Cancer Awareness Month. It was an effort that was led by Councilmember Paul Koretz, right? Councilmember Paul Koretz for many years, and I was delighted to take it over because this was one of those presentations in City Council where I learned. Ovarian cancer is a disease that too often goes undetected. It has been called the silent killer because its symptoms are subtle, and for too many women, they go unnoticed until it's too late. I was, as I mentioned, largely in the dark about ovarian cancer and the need for screenings. I didn't know that there are no standard screenings, that there's no one-size-fits-all test, or that this disease remains the 5th leading cause of cancer death among women in the United States. 1 in 78 women will face this deadly diagnosis, and without reliable screenings, it's incumbent upon us as women to be proactive in listening to our bodies and recognizing the symptoms. But if you don't even know, how will you do that? Women's health issues are often like this, that we have things like menopause that are hardly talked about, urinary tract infections, and like ovarian cancer, things that are far more deadly. But the Ovarian Cancer Circle, who I am so proud to honor again in these chambers today, reminds us that we cannot and we must not put ourselves last. Born from the story of Robin Babini and the extraordinary courage of her mother, Paulinda, the Ovarian Cancer Circles has become one of the leading organizations in the country advocating for a cure and keeping up that drumbeat so that this issue is not forgotten, that it is not laid by the wayside, as so many women's issues often are. Paulinda took her own tragedy and said, "We will make something larger than myself and my family, and we will make sure that it serves all women." That circle, the Ovarian Cancer Circle, has built a powerful community here in Los Angeles, and you can see them dressed in teal behind me. It is committed to educating women everywhere about the symptoms of ovarian cancer, about raising the critical funds needed for research that will one day, and hopefully that day is soon, lead to a cure. And I hope that today, like this chamber has done in past years, today will serve as both a tribute and a call to action for this issue. And with that, I would like to introduce the inimitable Paulinda.
Good morning, President Harris Dawson, Councilmember Raman, and esteemed City Council members. My name is Paulinda Babini, and I am the president and founder of the Ovarian Cancer Circle, inspired by Robin Babini. There's a picture up there. When Robin was 16 years old, she began experiencing a range of alarming symptoms. Like many families, we knew nothing about ovarian cancer, and we do not carry the BRCA gene, which increases your risk for both ovarian and breast cancer. Tragically, her gynecologist did not even consider ovarian cancer due to her young age. By the time Robin was finally diagnosed with stage 3 ovarian cancer. She fought courageously, enduring over 2.5 years of surgery and chemotherapy, but in the end, she lost her life just at the age of 20. She was just beginning her freshman year at UC Santa Barbara. In the face of this unimaginable loss, I knew I had to do something and I founded the Ovarian Cancer Circle, inspired by Robin Babini, a nonprofit dedicated to raising awareness about this silent, deadly disease. Our mission is simply but urgent: to educate women and their loved ones about the signs and symptoms and risk factors of ovarian cancer, because knowledge can truly save lives. I give out these bookmarks, and we gave them to all the council members, and they talk about the symptoms on the back. I think it's on the screen, or it's supposed to be, the symptoms somewhere. Okay, well anyway, it's a bookmark. As you can see from the bookmark we shared on the screen, we tirelessly work to share this life-saving information. And we know it does save lives. We are proud and today to be joined by 3 of our incredible women: Flower Miller, Karen Gilman, and Pat Grotlich, who are all survivors and thrivers. They are the face of a hope that women can survive ovarian cancer. Shortly, Pat will share her personal story. On behalf of the Ovarian Cancer Circle and Dr. Sanaz Mamarzadeh, I want to extend a heartfelt gratitude to Councilmember Raman for her ongoing support for this proclamation recognizing the Circle for advocacy, and to Dr. Mamarzadeh for her groundbreaking research. A special shout out to Sarah Tamberg, Council Raman's senior advisor, for her dedication. This marks the 8th consecutive year, or the 9th, that the City Council has recognized September as Ovarian Cancer Awareness Month, illuminating City Hall teal, the national color of ovarian cancer. We also like to acknowledge and thank Councilmember Paul Koretz, who originally launched the Council's effort, and we have here Ali Samard, the Director of Communications from Paul's termship. Since our founding 15 years ago, we've raised over $1 million to support Dr. Mamarzadeh's cutting-edge research. And do I introduce Dr. Mamarzadeh? Yes. And it gives me great pleasure. Dr. Mamarzadeh is a physician, surgeon, tenured professor, and leading scientist. This year alone, she secured over $4 million in grant funding to advance ovarian cancer research, specifically targeting a recurrent disease, which tragically occurs 80% of the cases. It now gives me a great honor to introduce Dr. Sanaz Mamarzadeh.
Okay, thank you all for your attention. We're here to shed light on gynecologic cancers and all the women who have been affected by these diagnoses. We heard the statistics, and I'm going to talk about both endometrial and ovarian cancers, and they account for the 5th and 6th leading causes of cancer-related death in women. Though despite their prevalence, they continue to be understudied and also underfunded. Councilmember Raman talked about this. I think part of the reason is that they hit below the belt. There is reluctancy to talk about these cancers, and also these cancers solely affect women. We heard a little bit about the challenges. Patients with advanced ovarian cancer often come to us and not knowing what the signs and symptoms are, hence patients are diagnosed at late-stage disease. Many times, even the physicians are not cued to those symptoms. I've also taken care of patients with advanced endometrial cancer who face a similar kind of challenge. And in many cases, we operate on patients, provide chemotherapy, and in many of those cases, the cancers can recur. So this is a challenge. This is a problem we're trying to solve in our lab. We're very committed to do this. I'm very fortunate to have brilliant scientists, collaborators working with us at UCLA. And I'm just going to very briefly summarize 3 key approaches that we're taking. 1, to understand the nature of the cells that cause recurrence of disease and how can we better target them. 2, to devise innovative and new immune therapy strategies that can hopefully eradicate the cancer. And 3, design and test cancer vaccines that hopefully can reinvigorate the patient's own immune system, preventing relapse. But to do this kind of research, we actually need funding. And the funding for gynecologic cancers is really dismal. I'll give you some statistics. Prostate cancer as a disease gets 16 times more federal funding for year of life loss compared to endometrial and ovarian cancers. So while we always apply for federal funding sources and competitive grants, we also rely on philanthropic support. That is why this partnership with Paulinda and her group has been incredible, not only in raising awareness, but also raising philanthropic dollars needed to do this kind of life-saving research. So thank you all for your attention to this important cause.
And now we'll welcome Pat to speak. I didn't know I was doing the introduction. Welcome.
Good morning. Thank you for all of you for taking time from your busy schedule to meet with us for Ovarian Cancer Awareness Month. My name is Pat Grotlish, and I am a survivor. I live in Marina Del... Thank you. I live in Marina Del Rey with my feral cat. My daughter works for the Keck Medical Center at the USC campus as a substance abuse specialist. My career, for most of my career, I worked in the office furniture industry for Steelcase and for Herman Miller. In 2012, I made a career change. I joined the construction industry as a construction design manager for National Gypsum Company. I retired on December 31st of 2024. Since retiring, I have been doing volunteer work for UCLA Medical Center in Santa Monica, for the La Brea Tar Pits, and for the Ovarian Cancer Circle that was founded by Paulinda Bambini in order to raise funds for Dr. Mamarzadeh for her cancer research, her ovarian cancer research. My cancer journey started December 24th of 2023. I went to the UCLA Urgent Care Center because I thought I had a urinary tract infection. After the doctor looked at my test results, he said, "You do not have an UTI." And he sent my results over to my primary care doctor at UCLA. At this point, cancer was the furthest thing from my mind. Nobody in my family that I knew had cancer. I never smoked. I exercise regularly. I drink very little alcohol, and I'm a pescatarian. My primary care doctor referred me to a urologist. After the examination, she said, "I am going to make an appointment for you with a wonderful doctor." And when I was in that exam room, she picked up her cell phone and she called Dr. Mamarzadeh's office, and she set up that appointment for me. I was beginning to understand that my medical condition was much more serious than I had originally anticipated. Dr. Mamarzadeh scheduled me for an MRI, for a CT scan, and for an ultrasound. I had cancer in my left ovary. I needed surgery, and I made the decision to have a total hysterectomy. The surgery went very well. The good news was that the cancer was confined to my left ovary. The bad news was that when they did the abdominal washing, they found abnormal cells. I had 6 chemotherapy infusions every three weeks. My last infusion was 13 months ago. I am incredibly grateful to the wonderful care that I received from UCLA Medical Center, especially Dr. Mamarzadeh. I do have some side effects, but I am just grateful. I am optimistic about the future. Thank you very much.
Thank you for sharing your story. Thank you so much to Pat for sharing your story. Thank you, Dr. Mamarzadeh, for your dedication to an under-recognized disease that impacts women across the world. And thank you, Paulinda, for bringing our attention to this year after year. Because it wasn't up when you were talking, I do just want to read out the symptoms because they are
Symptomatic of other diseases.
yeah, they're symptomatic of so many other diseases. You may never know that what you have is ovarian cancer. And they're often vague and misdiagnosed. Abdominal pressure, bloating, discomfort, or bleeding, nausea, indigestion, or gas, feeling full but eating less than normal, unusual or lasting fatigue, shortness of breath, unexplained weight gain or loss, urinary frequency, that's why you were testing for the UTI, or constipation or diarrhea. These are symptoms of so many other illnesses, and if we don't know to look for ovarian cancer, we may never discover it. And the earlier you detect it, the higher our chances are of surviving it. So I wanted to just read all of that out before I presented to Paulinda and the members of the Ovarian Cancer Circle our recognition from the City of Los Angeles, and to thank all of you for your time and attention and awareness of this issue. I know it has impacted people around this horseshoe personally in the past, and I hope that it doesn't impact any of us. But if it does, that we are aware enough to get the care that we need and that we are able to support Dr. Mamarzadeh's work. So thank you, Paulinda. Thank you to the Ovarian Cancer Circle. And I wanted to make sure that we recognized your work and the work of this is for the Ovarian Cancer Circle, a recognition from the City of Los Angeles, as well as a recognition for Dr. Mamar.
As you're presenting those beautiful certs, I just wanted to thank you, Councilmember Raman, for taking the baton on this presentation, and say to all of you that are doing this work and have branded your work with the color teal, which we will light up City Hall during this weekend in, your work is so, so important. You know, I think this happens to women everywhere. It happened to my mother. You go to the doctor and they say you have some of the symptoms that Councilmember just said, and the doctor will tell you, oh, you're just stressed, or oh, you need to exercise more, or oh, you need to drink more water. So raising consciousness among women and among medical professionals is as important as the science that takes us towards a cure to cancer. And so, again, thank you all for continuing to raise the flag and to raise awareness around this issue that so many of us face. Thank you.
And thank you, Council President, for giving us this space again in this chamber to mark this month. Thank you all.